Welcome to Doc Talk, your guide to back and neck health from the spine specialists at the Texas Back Institute.
Hi, my name is Dr. Richard Geyer. I'm a spine surgeon and one of the original founders of Texas Back Institute. When we first founded the Institute back in the early 80s, we were always involved with clinical research, and we recognized the advantages of research in being able to provide our patients with the most up-to-date as well as the most beneficial treatments. When we first started our research institute, we had been involved with using some of the very early diagnostic techniques that are commonplace today. For example, we were one of the first to use CT scanning, we were one of the first to do MRI scanning, and then we also published a lot of literature with respect to discography, which is a well-known, accepted diagnostic study to determine where a patient's pain may come from. But we didn't stop there. We then became involved with pioneering many new surgical techniques. We were one of the first to do endoscopic disc surgery. We originally called that arthroscopic surgery, but under my former mentor, Parvis Kambin, we taught many courses for that. So we are not new to MIS. In fact, we were one of the pioneers. We were one of the first to do laparoscopic surgery and the first center to do thoracoscopic surgery. And then we began involving ourselves in more clinical research with respect to electrical stimulation to accelerate bone healing, and also in the various artificial discs. And this is something that I'm perhaps most proud of, in that we have been involved in over 14 IDE studies, which are FDA studies, testing various artificial discs. We're involved in this because we recognize the advantage for the patient, that is restoring the back to normal motion rather than fusing it as we had done for so many years in the past. We were the lead investigator sites for many of the artificial discs, for example, the Charité and the ProDisc. And we are continuing to study this area. If you'd like to learn more about the research that Texas Back Institute has been involved with, or any of the current studies that may be applicable to your problem, please contact us or go to our website and look under the Research Foundation.
For more information, please call 1-800-247-BACK or visit www.texasback.com.